I'm Dr. Rita McGuire. I'm the Chief Medical Officer and one of the co-founders of Wakana. Tonight, we're going to be talking about CBD versus medical marijuana. We're going to be learning the difference. This is a call for healthcare professionals so that they can understand how this plant works and they can really help to assist their patients as well. I want you also to meet our medical advisory board. Yes, our medical advisory board is made up of healthcare professionals. It's made up of MDs, also PhDs, RNs, naturopaths. We have also dentists. We have pharmacists. We have chiropractors. So excited that we have a group of medical advisors that are advocates for CBD, that really have studied the research and really do share a lot of topics with us as well on Tuesday evening. So that brings me to Dr. Sanjay Gupta. It really was Dr. Sanjay Gupta, my colleague, who has made cannabis mainstream. See, in 2009, Dr. Sanjay Gupta said no to weed. He said there was absolutely no medicinal benefits for using this plant in medicine. There was a safety issue. There were potential risks for addictions, and he was absolutely not on board. But it wasn't until Dr. Sanjay Gupta started to travel. He started to travel to other countries. He started to interview scientists. He started to interview other physicians, but he started to interview patients, thousands of patients who utilize this plant and have absolutely improved their challenges. He interviewed a little girl by the name of Charlotte Figi. This little girl has something called Dravet syndrome, and unfortunately, Charlotte Figi passed away at the beginning of COVID from COVID, but she had a history of having over 300 seizures a week. It's called Dravet syndrome. It's a childhood epilepsy, and it wasn't until her parents introduced her to CBD, introduced her to the cannabis plant, this little girl went from having 300 seizures to 3 seizures a week. So in 2013, 2014, Dr. Sanjay Gupta came back and made a public apology. He said, you know what? As a physician, I didn't dig deep enough. I didn't dig far enough into the research. I didn't talk to enough healthcare professionals. I didn't talk to enough patients. I didn't look at what they were doing in other countries. He said that we have been systematically misled about this plant. So Dr. Sanjay Gupta coming out with all of this data, all of this information has really made cannabis mainstream. And that's why I think it's super important. It's incredibly important for not only lay people to understand how this plant works in the body, but healthcare professionals understand how this works in our body. So when we look at the cannabis plant, it has 2 main species. Marijuana, that's the part of the plant that has high THC levels that gives us the high. And then we have hemp. Hemp gives us the health without the high. And the way it does that is that hemp contains large percentages of what we call CBD or cannabidiol. And that's what we'll be talking about tonight. It has very low levels of THC. In fact, hemp is defined as containing less than 0.3% of THC. You see in marijuana, marijuana typically has percentages as high as 20 and 30% of THC, and that's why it gives us the paranoia, it gives us the euphoria, it even gives us the munchies. So from marijuana, yes, we're able to extract from the plant and make oils. We have flour, but from hemp, which is an industrial agriculture, not only can we get those oils and tinctures and flowers and so many products that we're seeing on the market for our overall wellness, but we're able to use the fiber to make rope, to make houses. Yes, there's something called hempcrete. Your next home may be built by using hemp. In fact, the very first automobile, the Model T Ford, was produced from hemp. The very first Bible, yes, the very first Bible was constructed from paper that was made from hemp. So hemp is a very important resource. It's a very important agriculture, but it's also used for medicinal purposes as well. So again, cannabis, the family has two main species: marijuana, which has high levels of THC, and hemp, which has 0.3% by definition of THC. So hemp gives you the health without the high. So let's look at how hemp is grown. And this is really important when you think about products, right? You've got to think about products because products come from the biomass of the hemp plant. So the leaves, the buds, the flower. Hemp is grown organically, and it's important that it's grown organically because hemp is a bioaccumulator, which means a bioaccumulator accumulates anything that's in the soil. So if you're planting hemp and processing a CBD oil in soil that's not organic, that soil potentially could have heavy metals, pesticides, mold, fungus. That product could have a lot of things that could harm you, could harm your grandmother, that may be immunocompromised, meaning they may have cancer or some other autoimmune condition that can make them very sick. So organically grown hemp is very important, and it's really important that the soil is well drained. This is a plant that really takes a lot of love and a lot of care to produce the right percentage, again, of THC, which is 0.3% or less. So when we look at the difference between CBD and THC some more, we see that the growth cycle is a lot shorter with THC. We see also the growth cycle with CBD is a little longer, but just know that CBD is non-psychoactive. So CBD that's sourced from the hemp plant will not give you a high. And again, CBD sourced from hemp can be used in clothing, body care, and other products that we'll learn about a little later. So I can't emphasize this enough, the difference between hemp and marijuana. Yes, they both come from the cannabis sativa L plant, but marijuana has high levels of THC. Hemp has 0.3% or less of THC. Both contain CBD, but again, the hemp gives you the health without the high. So none of our products that we offer here, none of the products that we're talking about here are sourced from marijuana. None of the products will give you a high, a paranoia, or euphoria. All of that is the reason why there is a CBD product source from the hemp plant. So let's look at the scheduling of marijuana. See, marijuana is still a Schedule I drug. A Schedule I drug is a drug that has a high potential for toxicity and addiction. A Schedule I drug has no medicinal purposes and has a very high and a concerning safety profile. Well, in 2018, the Farm Bill was passed, and that Farm Bill removed hemp from the Schedule I classification. So no longer is hemp classified as a Schedule I drug. Now, marijuana is, but hemp is not. So hemp is an agricultural plant that is legal to cultivate to sell and to consume in all 50 states. Now, the little caveat with that is the fact that not all of the states read the federal memo. This is a federal law that was passed in 2018. So some states still kind of skirt around the fact that it is a legal commodity. So when we look at the FDA has only one approved CBD medication, and it's called Epidiolex. Epidiolex is a medication that's used for seizures, treating seizures in children, like Lennox-Gastaut syndrome or Dravet syndrome, like the little girl Charlotte Figi had, or tuberous sclerosis complex. This is the only FDA-approved prescription. It is a synthetic form of CBD, and it costs $3,200 a month. Yes, $3,200 a month. So you can see why the option of utilizing a CBD product is very, very attractive to lots and lots of parents. We have Syndros, which is dronabinol, which is used to treat nausea and vomiting. It is a THC medication. The slide is a little blurry, but it is about $1,500 a month. So this is one medication that some physicians will use in the US to increase appetite in those who are HIV/AIDS. Again, a prescription. Marinol is another prescription. These are all synthetically made THC products. I wanted healthcare professionals to understand that these are the only FDA-approved products that are regulated in the United States as being legal. But Marinol is another medication that is utilized for severe pain, for difficult to treat pain disorders, and even those who have cancer where they've had metastasis. Then we have Sativex, which is not approved in the United States. This is a medication that is approved in the UK, and it is a 1-to-1, meaning it's 1% Delta-9 to 1% of this CBD. Again, this is a very expensive drug. This is a drug that is used to improve nausea and vomiting, to increase appetite, and this is a drug that's only prescribed in the UK. So when we think about CBD, you've got to think about the craze. Many of our patients, many of your friends, many of your family members, and even you on the line and Facebook Live are looking to understand more about CBD. And the reason being is that folks are sick and tired of being on so many medications that do cause side effects that then perpetuate another prescription for another medication. So CBD is absolutely an option. It's another tool that can be used in our patient's toolbox, not to substitute for their medication, but as a tool in the toolbox to help to address and assist in some of the challenges. So when we look at some of the top reasons for using CBD, we see that many folks are using CBD for relaxation, for stress and anxiety relief, to improve their sleep. How many of us out there can't get sleep, right? The stress of COVID, the stress of social injustices that are going on, now the stress of, right, Russia invading the Ukraine. I mean, there's financial instabilities, there's a lot of stress and a lot of sleepless nights. Relieving muscle pain, relieving chronic pain, joint pain, treating migraines. These are some of the many reasons that folks are utilizing CBD. And then when we look at the demographics, when we look at the age, we look at regions, we're seeing more and more baby boomers utilizing CBD. Yes, those Gen Zs and millennials are catching up with us, but we're seeing that they understand that there's now a product that they can use and not be high. They can utilize it and go to work. They can utilize it and take care of their babies. This is, again, another benefit of utilizing CBD versus marijuana, either medical or recreational. So let's look at CBD, because I've talked a lot about it, but I need for you to understand some of the benefits. Well, the benefits are many. In fact, there's over 20,000 peer-reviewed articles that look at CBD assisting in different challenges and disorders. CBD is an antibacterial. It inhibits cancer cell growth. We're seeing so many oncologists, cancer physicians utilizing CBD in their practice for their patients who are undergoing chemotherapy, who may have nausea and vomiting or a reduction in their appetite. CBD is neuroprotective. So we're seeing lots of neurologists using CBD in those patients who may have seizure disorder or who have had strokes, Parkinson's, dementia. CBD reduces seizures and convulsions. It also addresses the reduction of blood sugar levels, blood pressure. It reduces inflammation. It helps to relieve anxiety and pain. It absolutely helps to address skin disorders like psoriasis and eczema and even acne. It is a vasorelaxant. So CBD can improve the blood flow in your blood vessels. So we're seeing many people reducing so many medications that they're on. CBD also has a lot of other components that the plant utilizes along with CBD. There's other cannabinoids or compounds that the plant makes, like CBG and CBN and delta-8 THC and delta-9 THC. See, all of these cannabinoids or compounds work together so that there's a synergy on a cellular level that really is the reason that folks who utilize CBD sees results. So let's look at some of the other compounds, not that the plant makes. Those are called phytocannabinoids on the right, but our body produces. They're called endogenous cannabinoids or endocannabinoids. So yes, anandamide and 2-AG that you see on the left side of this slide is found in high levels in breast milk. So you wonder why breastfed babies are so healthy and so happy? Well, they are getting endogenous cannabinoids. They're also endogenous or endocannabinoids are found in beer hops and dark chocolate. But just know that our body produces cannabinoids just like the plant produces cannabinoids. So the way that cannabis works in the body, and this is my favorite slide, because as a physician, I wanted to know 4.5 years ago, how does it work in the body? Where is the science, right? And the science is the endocannabinoid system. This system was discovered in the early 90s. That's when Dr. Rita was at Wayne State School of Medicine in Detroit, Michigan. But guess what? They didn't teach this in any of our classes. In fact, it's stated that around 9 to 10% of medical schools are even teaching their students about this science, the endocannabinoid system. So this is the most vital regulatory system in our body. This system maintains, or this system regulates and modulates our blood pressure, our respiratory rate, our sleep-wake cycles, our metabolism, our digestion, our pain perception, our stress level, our depression level. This is the most vital regulatory system in our body. Yes, it's vital, more vital than our circulatory system, our nervous system, all of those systems you learn about in high school and college. This system is made up of receptors that are looking for cannabis to bind with and send signals to different areas of our body to keep our body in balance. We call it homeostasis. So these main receptors are CB1 and CB2 receptors. You can see in the slide, these receptors are responsible for appetite, our immune cells, our motor activity, our coordination, our pain perception, our short-term memory, our thinking. Our CB2 receptors are found in different organs and glands that are responsible for our immune system, our reproductive system. So just know that when you consume CBD, when you consume cannabis, that these receptors bind to different organs, our brain, our central nervous system, our heart, our lungs, our kidney, our skin, our teeth, to send a signal to areas to put it back into balance. So let's talk about how CBD reacts with other medications that you may be on, that our patients may be on, right? CBD is metabolized in the liver. It's metabolized through a pathway called the CYP450. And this system, many medications go through the same process to be broken down in the body. So when you consume CBD and you're using medications, one medication that comes to mind is a blood thinner called Coumadin. It potentially can interact with that medication. And with Coumadin, it could interact and cause the blood to be even more thin, right? And we wouldn't want that. So that's why with certain medications like Theophylline and Coumadin, it's not that you can't utilize CBD, but your doctor may need to monitor your blood levels just a little bit more closely. So just know that yes, CBD can negatively or potentiate medications that you're on. Two main medications is Theophylline, that's for asthma, which is an old medication. Not many people use Theophylline, but many physicians are still using Coumadin or warfarin. So those are two medications where your doctor just needs to know. We want all of our doctors to know when we're utilizing CBD in the event that it may interact with medications that you're on. So let's talk about CBD showing up on your drug test, because that's a real concern, right? We don't want anyone to lose their job. When we talk about utilizing CBD topically, like a lot of massage therapists and massage med spas are utilizing CBD in their massage treatments. Those products will not pass the blood-brain barrier. So topicals are safe. They won't show up in your urine drug screen. But there are products that could potentially show up on your drug screen. Now, the research shows that if you're using what we call a full spectrum product, that's a product that utilizes the whole plant that has the legal limit of THC, which is 0.3% or less. The research shows that you would need to take about 1,000 to 2,000 milligrams a day to have 11 to 23% chance of showing up in your drug screen. I mean, that's a lot of CBD. That's like you drinking bottles of CBD every day, right? Very rarely does someone need that high of a level. But then we have something called broad spectrum products or isolates. Those are products that can safely be taken for those who have urine drug screens. Our broad spectrum products contain less than 0.0% of THC, and the isolates contain only CBD. So just know that when you are utilizing CBD, and if you're undergoing random drug screens, that one, you utilize a CBD broad spectrum or isolate, and two, you need to ensure that your employer is utilizing a very specific urine drug screen. See, a lot of these urine drug screens that you get from Walgreens or CVS, that drug screen doesn't really know the difference between CBD and THC. But there are urine drug screens out there that are very sensitive, very specific, that can absolutely tell if the person's taking CBD or if the person is taking THC. So LabCorp is a lab that will do a CBD to THC ratio. There's also things that you should know before buying a hemp-derived CBD oil. And the reason why this slide is so important is because you can find CBD everywhere, at the gas station, at the smoke shop, right? Now, I wouldn't trust those CBD products for many reasons. One, you have no idea what the source is. Where was it grown? Was it grown organically? Where was it formulated? Was it formulated in someone's garage or their basement? You know, all of these things are very important. Does it have a certificate of analysis? Was there a third party validating that this product is safe, effective, and this product, is it coming from the hemp species? Does it contain the legal limit of THC? So this is why locking arms with Wakana and a product, a brand that you can trust, a product that is grown organically. Our products are sourced from organic farms in Oregon and Colorado. Our products are tested. They go through a third-party validation. Our products have certificates of analysis. So truly, you need to understand that what's in the bottle does matter and that not all CBD is made equally. How is the CBD extracted? How is that CBD taken out of the biomass, the plant, and extracted into an oil? Well, the cleanest method is a supercritical CO2 extraction method. There's other methods like butane and propane and alcohol and all of these different methods, but this is the safest, this is the cleanest, this is the most efficient way of extracting the oil. So that's important too. So all of these answers you want to know before consuming and purchasing a CBD product. So there's different ways to consume CBD. There's oral applications or tinctures, there's vape pens, there's pre-rolls, there's liquid water solubles, there are edibles, there are gummies, there's spices, there's butters, there's capsules, there's topicals, right? And then we have products for the face. We have products for the hair. So there's all sorts of ways that you can consume CBD. But the science is something that I want you to look at. If you're a healthcare professional, you're on the line, if you're on Facebook Live, you absolutely want to utilize PubMed. PubMed has a lot of research, a lot of data. And since the Farm Bill was passed in 2018, you're now seeing large teaching institutions like UC San Diego that are doing research on CBD. Why? Because it's legal now, right, to be done on humans. They're doing research with ADHD. They're doing research with autoimmune conditions. They're doing research with opioid addictions and looking at utilizing CBD therapeutic levels or products to utilize in depression and anxiety. These are articles that talk about utilizing cannabidiol or cannabinoids in the management of difficult to treat pain. You know, in medicine, difficult to treat pain is sciatica, neuropathy, those who have multiple sclerosis, other conditions like gout. When we look at the potential for treatment for anxiety disorders, lots of research done in this arena, as well as therapeutic potential for CBD being used in cancer treatments. Again, utilizing it for nausea, vomiting, increasing appetite. CBD also, it's non-psychoactive, of course, that's what we're talking about tonight, in the prevention and treatment of GI disorders like ulcerative colitis, Crohn's disease, reflux, all of these GI disorders, lots of research is going on as well. So I'm going to end the presentation here. I want to thank you for joining. What I do want to do is quickly go through some of our products because I want you as healthcare professionals to understand that your patients absolutely need to have a product that is tested, that is safe, that is effective, and it is a product you can trust and a product that works. So our product line, again, every product has a certificate of analysis where we're looking at the potency of the product milligram for milligram. We're ensuring that the amount of Delta-9 THC is within limits, 0.3% or less. Pesticides, mold, mildew, heavy metals. Any of our products that are ingested internally has a full panel certificate of analysis. So the statements made regarding these products have not been evaluated by the Food and Drug Administration. The efficacy of these products have not been confirmed by the FDA-approved research. These products are not intended to diagnose, treat, cure, or prevent any disease. All information, I can't emphasize this enough, all information presented here is not meant as a substitute or an alternative to information from your healthcare practitioner. Please consult with your healthcare practitioner about potential interactions. We talked about some of the drug-drug interactions or other possible complications before using any of these products. The Federal Food, Drug, and Cosmetic Act requires this notice. So here are our tinctures. Tinctures are products that you place underneath the tongue. We do have two lines. We have a power line, which is our full spectrum line that contains a legal limit of THC, 0.3% or less. And then we have our broad spectrum line. That's our pure line. Our power line is full spectrum. Our pure is our broad. Our power is our full spectrum. Our pure is our broad spectrum. That is the product line that you can utilize if you are undergoing a urine drug screen. We also have an amazing product that's water soluble. So you can put it in your water, you can put it in your juice. It's a great product line for those who may have cognitive dysfunction. They may have some issues with dementia that they don't understand to hold that oil underneath their tongue for a minute before they swallow. We also have a more therapeutic line called our Hemp MD. That is our more potent product. It's 900 milligrams versus the 500 and 300 milligram of CBD for those who are addressing more severe challenges. We also have a product that's in a tincture form as well as a topical form. It's our Hempowered Hair. It's a great product for those who are addressing hair loss, hair thinning. Maybe you're going through menopause and you notice some thinning of the hair. Maybe you've had a hairstyle traction. Maybe you've had excessive heat or bad color, bad perm, where you've developed CCCA. All of these conditions can be addressed by, yes, CBD. So when we look at topicals, topicals are great products that offer local relief. Our number one seller in our company is our Extreme Power Pain Cream. This is an amazing product because, like so many of our other products, we have a proprietary formula. That means we've enhanced our CBD with essential oils that enhance the effectiveness of our products. So when we talk about inflammation, when we talk about this ease of joints and muscles, when we talk about conditions that keep us up at night or keep us uncomfortable during the day, a topical product is what you want to apply. We also have a liquid form of our Power Liquid Relief, our Doctor's Reader's Rub, again, which is enhanced with essential oils that reduce inflammation. We have other products for the face. We have a facial serum, a mask, a moisturizer, because we understand that skin conditions, even wrinkles, we want to maintain the youthfulness of our skin. Skin is the largest organ in our body. CBD has receptors on the skin as well. And then we have body butters that are utilizing lotus, hibiscus, flowers, along with CBD to really address our overall health of our skin. Our edibles include our gummies. We have a CBD coffee. We have gummies that address weight loss, our flat belly gummies. We have gummies that address our libido. Yes, our libido, our king of the jungle gummies. We have our Delta 8 gummies. Delta 8 is another cannabinoid that is really adorned by millennials. They love our Delta 8. Delta 8 is a very close cousin to Delta 9. But it doesn't give you that euphoria or mind high, but it gives that body that relaxation. It gives that mind that creativity that many of us are looking for. We also have products that do not contain CBD, but address our immune system. Our immune defense tea. Our bitters tea is a great detox tea, cleansing the liver and the colon. So we've got some really incredible products here at Wakana. We also offer organic essential oils. Our First Defense is one of our top selling essential oils. That's a nasal spray along with CBD and many essential oils. We know that microbes, bacteria, viruses all enter what? Our nasal passages. So this is a product that really helps to reduce those microbes, really helps with the congestion and sinuses, but our other essential oils also are amazing. Our black seed, I say that every single person must have a bottle of black seed along with our other incredible products, because black seed is like that super essential oil. It helps with digestion. It helps with kidney, liver function. It helps with hair growth. It helps to reduce the inflammation in the pancreas. So it helps to rebuild the cells in the pancreas that produce insulin, the beta cells. So all of these are incredible products. And then we have smokables. We have a Delta 8 pre-roll. Our Delta 8 pre-roll is one of the other smokables. Our other smokables will be back on our website very soon, but smokables are great because they act acutely. Within 1 to 5 minutes of pulling on that pre-roll, 1 to 3 puffs will feel the effect on a cellular level in the body. I love pre-rolls for those who smoke cigarettes. We know that CBD helps to reduce cravings. It helps to block those cravings for nicotine. It helps to reduce the withdrawal symptoms that you have when you're coming off of cigarettes. So this is an incredible product line as well. We have spices, our garlic fire, our flavor king, our chili lime, our vegan butter, our culinary plus. These are all products that you can bake and cook with. So your favorite recipes, you're getting CBD to really address symptoms that you want to assist with. We can't say that any of these products cure any disease, but they will assist with challenges that you may have currently going on. Our hair care system, our Save, our strands, utilizing CBD, utilizing organic herbs to address hair loss, hair thinning, or to maintain that healthy head of hair that you have. We have a renewing shampoo, we have a detangular, we have a conditioner, we have a styling cream, we have something for beards and scalp for men, all organic, all utilizing CBD that also has receptors in the scalp, because the skin, again, is a part of your scalp. And then when COVID hit, we pivot. We had to do a little pivot and incorporate products that are safe for the home, for the office, for our produce, and for meat. It's Royal Defense. We offer hand sanitizer, hard surface sanitizer, produce wash, mask when you're traveling, because we understand that these are also essential products to keep us safe during this global pandemic. Let's not forget about sex, because many of us have been locked up for 2 years. They said that the number of couples that are engaging in sex more often has increased during COVID. So we offer King of the Jungle gummies to improve stamina, to improve libido for men and women. We have our CBD lube for those women who may have vaginal dryness or may need some assistance with discomfort during intercourse because there's a lack of lubrication. We also have that body butters, again, our lotus and hibiscus and aftershave creams as well. So we've got so many great choices. You can't go wrong. Lock arms with us here at Wakana. Amazing products, safe and effective. Now at 8 o'clock, which is in 15 minutes, we're going to have a business overview. So if you're on the line and you want to hear more about our products, if you want to hear more about the opportunity, you want to hear more about our co-founders, our mission, our vision, what we're doing here at Wakana, you want to lock arms with us. There's a Zoom link and passcode to join our 8 o'clock call. If you need more assistance, connect with the person that invited you on this line and they will get you connected. So if there's any questions on Facebook Live or any questions in the chat, I'm going to entertain some questions here. You can put it right down there in the chat box if you have any questions. If you're on Facebook Live, you can put your question right there on Facebook Live. Welcome, welcome, Dr. Christine. Dr. Christine, what field of medicine are you in? Welcome, Carmen, DeGray, Margot, Nima, Regina, Cherie Eppinger, Shirley, Vinay, the Natural Relaxer. If there's no other questions, then we will see you in about 15 minutes at our 8 o'clock business overview. I'm going to be joined by my business partner, Family Medicine. Wonderful. I would love to connect with you, Dr. Christine, and anyone who has some additional questions. I'm going to put my email. So Dr. Christine, I'd love to have a conversation with you. That's my email. Dr. Rita, no, it's Rita MD at Wakana.com. Rita MD at Wakana.com. Love to have a conversation with you, Dr. Christine. So join Vinay and I on our 8 o'clock business overview. We're going to really talk about our vision, our mission, our co-founders, our company, what we're doing, our products, and then the opportunity. So you don't want to miss it. Be well, be safe, and we will see you in 15 minutes.